And so what I want to talk about today is how to support caregivers, some of the challenges. There is something called a dependency ratio, and that is the ratio between people who are working age, let's say 18 to 64, and people who are over 65 and over. And that has also been shifting dramatically. So what that means is for every person who's aging, there are fewer and fewer people who are younger, who are working, who are contributing to Social Security, and who are available for caregiving, whether it be a family member or paid caregiving situation. So our challenge is to keep caregivers going. Now, I don't usually do things like this, but I think this is important. This is my personal history, grandparents, great-grandparents. I was fortunate enough to have lots of older people in my life. And I think the wonderful people who cared a lot about me, added to the quality of my childhood. There are a lot of people like this. And one of the reasons I think this is important is people who have had this experience are passionate about caring for older adults. There are a lot of people who are doing this. And actually, this is the best place for us to recruit people in paid caregiving situations, whether it's professionals, scientists, or direct care workers. They are often people who have had positive experiences with older adults earlier in their lives. Unfortunately, in a lot of instances, we chase them out of doing this, and I will talk about that a little bit later. My experience, I almost got chased out. The very first job I got was in a nursing home. I was a brand new nurse, didn't know anything. I thought I knew something, but I actually really didn't know anything at all. So here I am in a nursing home with very frail older adults. I was the only nurse there. Poor staffing. I will talk about this in a bit, some of the staffing issues that are still a problem. I couldn't provide the care that these people needed. I knew I couldn't. And I have to say the care wasn't great. I couldn't keep up with it, didn't have the skills, didn't have the knowledge, didn't have the resources. So I did what any 21-year-old would do. I called the State Department of Health, reported the organization, and lo and behold, I got fired. This was before we had whistleblower laws. It was before we had unannounced surveys. It was, what happened was they came to the nursing home with my copies of my letter and said to the director of nursing, "Is this true?" She said, "Absolutely not." Of course, they had told them they were coming, so they had, I got to work, and so everybody who worked in the building was there that day, so the staffing was great, the resources were great. So, you know, that was sort of a sad story. But, so we still have some problems there with staffing, not quite as bad as that, but still a problem. I think this is an interesting quote. Probably some of you have heard this before. This is Rosalind Carter, who said, "There are only 4 kinds of people in the world: those who've been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver." And that's all there is. How many people here are caregivers? Now, I would be willing to bet that there are more people than the ones that raise their hand, because most caregivers don't identify as caregivers. They say, "I'm just helping somebody." But they're not caregivers. So how about with that definition, raise your hand? Okay, went up quite a bit, yeah. That's actually one of the challenges we have in supporting caregivers, that if people don't see themselves as a caregiver, don't identify, don't look for resources. So how many caregivers do we have? There are currently, the estimates I've seen are between 38 and 41 million caregivers in the country, a huge group. Most caregivers, as I said, don't think of themselves as caregivers. The majority are female, 85%. Half are caring for a parent or parent-in-law, and 1 out of 10 for a spouse. So that tells you kind of where the challenge falls. So who are caregivers? Who are these folks? Average age is 49. That puts us squarely in the middle of working age, doesn't it? Yeah. Time spent in caregiving, people don't generally stop and count it up, but if you do, it's usually higher than you think it's going to be. 24 to 41 hours a week. That's a lot of time. 4 to 5 years on average. And if we paid people for the care they provide, now remember, this is low-wage work for a lot of folks. The majority of paid caregivers are direct frontline caregivers who make $10 or $11 an hour. I think that's actually shameful, but that's what people are making, many with no benefits at all. No sick time, no vacation time, and often no health insurance. It's offered to them, but they can't afford it. I don't know how many of you read there's a homeless series in the State Journal, and the last one had a profile of a CNA who's been homeless because a CNA's pay is not enough to pay rent. She didn't have a substance abuse problem or anything like that. She just simply couldn't afford rent. So this is who we have taking care of the most frail, vulnerable folks out there. It's a problem, I think. Okay. So what do caregivers do? I could probably ask people in here what you're doing, but this is not an inclusive list at all. Transportation, people who shuffle someone back and forth to doctor's office appointments, in particular, physical therapy, clinic appointments, lab tests, x-rays, things like that. And as you know, for caregivers, this is a challenge because you don't just wait 5 minutes usually. You have a much longer wait. So it's not just the transportation and the difficulty often helping people who are frail and disabled moving, but it's also the time that you spend waiting and sort of downtime and not very useful. Meals, getting meals for people, and they're not something I'm going to go into, but as people age, there are more and more challenges with eating, everything from swallowing to chewing, to taste and flavors change, to special diets. So this is no small task to just figure out. A lot of the work is invisible. It's not directly what you see. It's figuring the stuff out behind it. So what can they eat? What can't they eat? What will they eat? What's healthy? How do you help someone so they don't choke? All those things are important. Getting dressed. Balance is a really important issue for getting dressed. I mean, if you think about it, getting pants on, getting socks on, getting underwear on, it all takes balance and some strength. So that gets more and more challenging. Making and keeping appointments, which I mentioned. Medications, that's a real challenge for people. I've read a study recently about pharmacists trying to do what they call medication reconciliation. Someone's in the hospital, they get discharged, and the pharmacist is trying to figure out, so what did they come into the hospital with? What's still at the pharmacy? What's in the medicine cabinet at home? What prescriptions are we sending them home with? How many of these things are incompatible with each other? For professionals trying to figure this out, it's a real challenge. So you can imagine what it's like for family caregivers who are trying to figure out, get all these pill bottles. Are you supposed to take this now? Are you not supposed to take it now? Without a lot of help. And we've changed our healthcare system so that a lot of as you know, your primary care provider doesn't generally follow you into the hospital. You have a whole different set of care providers. So they get to decide what sort of medications you're on now. So trying to reconcile those with what your primary care provider has decided to give you is often a big challenge. And one of the biggest problems we have is people taking medications inappropriately, or medications they shouldn't be taking, things that are incompatible with each other, or a lot of medications that older people should actually never be taking at all. And that's still an issue. Monitoring symptoms, being vigilant. One of the biggest challenges of caregivers, not so much people who live in, but other caregivers is this person safe? Is my mom still safe at home? How much should I worry? What sort of resources can I bring in? At what point can they no longer stay home alone? Very tough decisions to make and to talk about. Another thing that, if caregivers have time, a really important thing to think about is, how do we maintain this person's quality of life? How do we keep their relationships going? One thing that's changed dramatically is with technology. I was reading a Pew report recently that talked about the increase in the number of older adults who are using all kinds of technology, whether it's tablets or laptops, things like that. It's increasing dramatically. Part of it is people who are familiar with these things are aging, so that they now show up in the statistics. But a lot of it is also older people becoming actually pretty good at using smartphones and tablets in particular. So that's increased pretty dramatically. So what we have now, a kind of new phenomenon, I think Dr. Yang was talking about this earlier in terms of the networks, is we have grandchildren from California who call grandma in Boston every morning and say, "Grandma, it's time to take your medications." It's actually quite common. So you might have someone who says, "Okay, I know it's time for grandma to take her medications at the time that I go to this first class in the morning, so I'll call her on my way to class every morning." So there's a lot more of that going on. You often see people even in nursing homes who have tablets where photographs, family photographs, keep appearing. And they're able to send them, and then even if you don't know how to use the technology, there it is in front of you. So those are all things that have changed pretty dramatically. Going to give us a lot more options. So we have an increasing number of caregivers from a distance. This is partly a function of having only one or two children. The one might be on the other side of the country. So long-distance caregiving is becoming a huge issue. I don't have time to go into it. There are all kinds of things that have been set up in different cities to help people, most of which caregivers don't know about. 25% of caregivers, primary caregivers, are at some distance. They spend an average of $400 to $600 a month. Partly this is flying back and forth, or it's also paying for help to come in because nobody is there. Average about 3 visits a month. 80% are working. This is actually becoming a big issue, is employed caregivers. So what do we know about employed caregivers? I read a study recently that said 23% of all employees are caregivers, providing someone with care, very often a parent or a parent-in-law. I think that's a low estimate. There was a survey done recently in Wisconsin that put that number at 64%. 64%. And what was interesting about that study is it's a group that approached several employers and said, can we survey your employees about this? And most of the employers said, "Oh, we don't have a problem. We don't have a lot of working caregivers, but sure, go ahead." And this is what they found. So what this suggests is that it's not visible to employers. Some employers have actually kind of stepped up to the plate, see this as an issue, and are providing some resources, but not enough. So what does this mean? It's estimated to be $33 billion a year in lost productivity. Some of that is coming in late, some is leaving early, some is just not being able to concentrate, which we call presenteeism. You're there, but you're thinking about something else, you're worrying about something else. Those are all things that influence productivity at workforce. So providing support for caregivers should be pretty high on our agenda. Also, interesting, there's a lot of research that shows that people who do caregiving for long periods of time with no support end up with worse health outcomes themselves. And so what some research that's been done recently has shown is that caregivers actually, if you have caregivers in the workplace, which most places have, unless you're at Google, and even that, we've got a lot of grandchildren who are getting involved here. This is a big issue for employers and for the national economy. And 22% of retirees in one study retired early to provide care to someone, earlier than they would have retired otherwise. Now, there's a lot said. I got actually kind of angry recently. There was an article someone sent me from the Huffington Post that described caregiving as absolutely horrible, a burden, makes people sick, increases morbidity and mortality of caregivers. Caregivers want to go home and lock themselves in a room and get rid of the person they're taking care of. That's just not true. I won't ask you to raise your hands, but how many people who are caring for someone would just love to get rid of them? What people, well, there may be some. Don't raise your hands. Yeah. That goes for children too, probably. Yeah. What most caregivers say is it's overwhelming, they're stressed out, but they don't really want to give it up. There's a lot of rewards with caregiving. It's important in terms of the relationship. It's what you want to do for a person who you care about. What they want is some help doing it. There are plenty of rewards, and most caregivers would say they're not going to give it up even if they don't get help, but gee, it would be really nice to get some help. Just quickly to go through this, lack of preparation is one of the, what stresses caregivers? Needing some respite is high on the list. Difficult conversations is also really high on the list. And I'm just going to give you one example because it's very common. Has anyone here looked at parents or spouses, siblings, and thought, gee, I'm not so sure about their driving? You hear, yes, lots of yeses there. It's probably the first thing that usually adult children start to get concerned about. Did you see what Dad did in the car? Or there's a few dents on the car. Anybody know how that happened? That's, so now what do you do? Well, what a lot of people do is they say, let's not say anything, it'll upset him. I've heard of people who have just hidden the keys, taken the keys away. There's a lot of things that are probably not good to do. This is a place where early on you need a conversation. You need some problem solving about what are some options. There's also courses that older people can take that will help them become more careful drivers. There are strategies people can use to be more careful. Could be a vision problem. There are all kinds of things that could contribute to this. So rather than taking the keys away or waiting until it's really a disaster, having these conversations early, but being prepared to do that is a problem. Anticipating what's ahead, we find most caregivers don't know what's coming. You don't know what choices you're going to have to make. You don't know what happens when someone's discharged from the hospital, how you pick a nursing home, how you find someone to come into the home to provide care. These are all things that we have a lot of knowledge about, but caregivers don't have access to this information by and large. One other thing, AARP is in the process, it's not up yet, I just looked yesterday. They're in the process of developing a video that shows caregivers how to do things like changing Foley catheters, doing wound care, very technical things that people were admitted to hospitals for in the past. Now people are being sent home with a, here's a package of stuff, now you need to do wound care. And people are saying, I don't know how to do wound care. Not very much support. So AARP said there are so many people who are in this position that they've now made a video where they're demonstrating all these procedures and techniques, because there are thousands of people who are in that position. Caregivers get isolated. It's expensive. There are challenges with family dynamics, because if any of you have experienced this, siblings don't always agree on what to do with parents. And sleep deprivation is a real challenge for caregivers. So one of the things they need is well-timed, relevant information to support them in decision making and to anticipate what's coming ahead. And so that's, just hang on to that one, I'll talk to you about it in a minute. Care recipients, I couldn't find this new information, but several years ago there was a study done that showed that for every person in a nursing home, there were 4 living at home in the community with an equal or greater level of disability. So this just gives you a little bit of an idea about what sort of caregiving is going on in the home. Really high level caregiving. Not always possible to stay home. So then what happens? And this is another huge decision. I've heard everything from, we just told Mom we were going to the park and then she, all her furniture was moved and now she's in assisted living, to having, this happens. To having long conversations about it, to being afraid to have conversations about it. So these are the sorts of things that caregivers actually need support with. How do you approach it? How do you know? How do you know assisted living versus a nursing home or a retirement community? How do you pick assisted living? That's a whole separate topic in itself. This is the most rapid growing form of supportive living. So, we have now, because there are so many versions of supportive living for older adults, it's now called housing with services instead of assisted living nursing homes because of the wide variation. So now I'm going to shift to talk about paid caregivers in these settings. And by the way, the idea that when someone is moved to assisted living or a nursing home that they're no longer being cared for by their family is completely wrong. For any of you who have had relatives in nursing homes, family caregiving often continues at about the same pace once someone is moved to one of these environments. You're simply getting help doing it. So it doesn't actually decrease. So the only reason I'm showing you this is that bottom line is the nursing assistant, the group of $10, $11 an hour staff with no benefits, very little support, often working 2 jobs, often the only breadwinner, sometimes homeless. Many of these people, about 30% across the U.S., are at such a level of poverty that they qualify for food stamps, Medicaid, things like that. The RNs, as you see, 9%. In case you think those people taking care of your relatives in a nursing home or assisted living are registered nurses, licensed professionals, most of them are not. That's a problem we need to take care of. We are putting very vulnerable people who need careful monitoring and support to be cared for by a group of people who have very little training. Total training required by the federal government for this group of folks is 75 hours total, and then nothing once they're trained. No requirements in most, it varies state by state, but in most states nothing required. Challenges for paid caregivers. I could talk for days on this. I won't. My time's a little more limited than that. But most of my research for decades has been on looking at this frontline paid caregivers. What are the types of organizations that are, what's their organizational structure that's supportive of these workers? What do they need? What are their lives like? What's the best sort of training programs for these folks? Most of them are incredibly committed, passionate people who could make more at McDonald's. They get very little support, they get very little supervision, and very little training. So you think about this with the most vulnerable folks that they're taking care of. It's very much like daycare workers. I mean, we do this at both ends of the spectrum. They often have forced overtime. So here you are, you have 2 kids you have to pick up from school, and someone has just told you can't leave, and there's no one else to pick them up. If you leave, that's the end of your job. So forced overtime doesn't work very well, but that's what we're doing because there is such a shortage. And there's no surprise there's such a shortage because it's really hard work and because of this dependency ratio where there's fewer and fewer people available to do this work. They also experience a lot of conflict with families who have, reasonably so, higher expectations than what's happening in the nursing homes in particular, but also in assisted living. I thought someone would make sure that my mom didn't fall. Well, in most nursing homes, there is, say, on the day shift, when it's really richly staffed, maybe 1 to 8. And when you think of the level of care that people need, taking care of 8 people, I mean, family members at home, it's all they can do to take care of 1 with help. So now you're in another setting and you've got 8. It's a pretty impossible task. They also don't get continuing education. So they don't really know a lot about the problems of people that they're taking care of. And just to sort of hark back to what we heard this morning, I think one of the greatest problems that we have, whether it's at home or in nursing homes or assisted living, is not getting older people to keep walking. As soon as you stop walking, you start losing function. And we often, well, it's quicker and easier to do it for someone. You think you're being kind doing it for someone, and what you find out is that you actually end up disabling people over time. So professional caregivers need the same thing that family caregivers do. They need a lot more information, a lot more support, a lot more training, and more hands on deck. Just a very quick note, and I'm almost finished up here, but there is, I get angry when I hear people in elected political office, which is actually not unusual, say, gee, if people would only take care of their family members, we could just save huge amounts of money and we wouldn't have this crisis. That's going on, certainly. But there are, fortunately, in the last several years, some laws that have been introduced to support folks. And you just want to tell you, we used to have something called filial obligation laws. They were in like the 1930s and 40s. And the law was, if an older person applied for assistance, they could only get assistance if they signed something that said the state could sue their children to get the money back. Ronald Reagan tried to resurrect these when he was in office, and not since. As you can imagine, it didn't meet with very positive response. What happened was older people moved out of their state, which isn't that great, moved to another state where they couldn't end up suing their children because it didn't cross state lines. Fortunately, we're a little more enlightened than that lately. There are a lot of bills that have been introduced. One in particular that's really nice is Hawaii. They haven't passed it, but they introduced a bill that would give caregivers, home caregivers, $72 a day to provide care for someone for as long as it took. One of my favorites is one that has been introduced twice, and we're hoping it'll be introduced again, is a change to Social Security law that would allow caregivers who leave the workforce and stay home and care for someone to use those years as accruing credits for being part of Social Security, because not only do they lose income, but they lose then Social Security benefits later because they're leaving the workforce. There are a lot of other laws about staffing levels in nursing homes that are, you know, there is no required minimum staffing level in nursing homes. What the law says is that they should provide care, they should provide sufficient staffing to provide the best practical level of care, whatever that means. So certainly a lot of ways to get around this. So let me just briefly tell you a couple of things that we're doing in the Center for Aging Research and Education. Three things. Three projects we're working on now. One we call GeriRes, and this is a residency program for nurses working in long-term care settings, nursing homes, assisted living, and home care. Residency programs are very popular in hospitals. Nurses love them. When you graduate, it's sort of like physicians, pharmacists, you graduate, you're not really done. You still have a lot to learn, and throwing someone into these complicated environments with no support and to just sort of do it all at once makes people leave. We have a very high turnover rate. The turnover rate in long-term care for nurses is 40% a year. First 3 months for new grads, it's close to 70%. Well, one of the most important things for older adults in these settings is to have continuity of caregivers, because you develop relationships with people, they learn how to provide your care, and so if they keep leaving, you end up with lack of continuity, with interrupted care, and with lower quality of care. So residencies keep nurses in place because it provides a graduated increase of responsibility, a mentor, coach, and some support. So what we're doing, because nursing homes, assisted living, and home care don't have these programs, it's a recruitment problem because nurses want to go places where they have a residency program, and it's a retention problem because they get overwhelmed very quickly. So we've been pilot testing this for a few years and about ready to launch the nursing home form of residency. And fortunately, a lot of people are interested in doing this. So what this does is it sets up a new nurse in a nursing home with a coach, a mentor who's committed to their success. It's a graduated increase in responsibility, and it focuses on the things that people really need to learn in long-term care settings. So that's one program we're working on. Another one is, you may not be aware of this, but there are I was reading an article that was written in 1960, and it said the average age of people, the average longevity of people with an intellectual disability was about 28 years. They died early, a lot of them in childhood because we didn't take care of them. You get a tooth abscess or pneumonia and we just let them go. Fortunately, we don't do that anymore. We take care of people much better than we used to. So now for the first time, we have a huge group of people with intellectual disabilities who are entering old age. Most of them have very similar life expectancy to us now. But what we found is they live in group homes for the most part with people who were not trained at all in any kind of health care and who are having a very difficult time struggling with some of the changes that occur in old age. So we've developed a training program, a support program, and a manual online training program for this group. We've also now converting that into just a manual to help people care for older adults. And we've got a couple of copies out there if anyone's interested in looking at them. They're pretty easily available. The last one is one that we're kind of in the middle of right now. Still have a ways to go on this. This has been an interesting challenge for us, something new. This is an app. We've finally named it eCare, but if anybody here can come up with a better name for us, I promise there'll be a nice prize at the end of that. We need a better name. So this is, I talked to you a little bit about the challenges family caregivers have in terms of anticipating what's ahead. How do you start a conversation? How do you, I think my mom probably isn't safe here anymore, but how do I know? How do I assess that? What are the things I should look at? And based on the answers to those questions, what are some of the options that I could consider? And if I take these options, what am I likely to find along this path? And so we're creating an app that does that. And so it's a decision, so it's anticipatory guidance, decision support, identifying options, not telling people what to do, just saying, here are the options, here are the likely outcomes of each of these paths, and so this is how to make a decision. So it's all evidence-based, using the research out there and hundreds of interviews with caregivers. So I think that's it. I'm trying to finish in the time that I'm allowed here. So this is the sort of things that actually nurses do, and it is basically trying to help people deal with the consequences of health problems and disabling conditions that they have. So we will rely on the basic scientists to keep working on trying to get rid of the problems, and in the meantime, we'll keep developing ways to support people who are still experiencing these problems. So, thank you.